Good morning, and thanks for joining us for today's webinar. What you should be seeing is the home screen for the ODG by MCG.com platform. Today, we're going to review the tools on the platform, and particularly the access tools for the ODG medical treatment guidelines and for the drug formulary that have been adopted by the Arizona Industrial Commission. I want to start by giving you just a little bit of context. ODG has been around since 1995 when the first official disability guidelines were created by a company called the Work Loss Data Institute. They were intended to help workers' comp stakeholders project potential disability durations resulting from various work injuries. The guidelines drew from 3 million or so federally sourced claims and represented a real hallmark in bringing data analysis to the workers' comp industry. In 2003, ODG began publishing evidence-based medical treatment guidelines based on scientific medical studies. The goal was to identify treatment that had been proven to be efficient by medical experts so that stakeholders could rely on that treatment to get the best possible outcomes for injured workers. For ODG, it was a move from simply projecting potential results to actually improving outcomes by better medicine. The treatment guidelines were initially published as bound volumes, and they eventually became available as an online platform that was issued based on a subscription service. Since the initial publication, ODG has been formally adopted by 11 states, including Arizona, and it's used by healthcare providers and stakeholders in every state and in countries around the world. In 2017, ODG was acquired by a company called MCG Health, which is the leading provider of medical treatment guidelines. And ODG was acquired as its workers' compensation division. With the benefits of MCG's additional resources, in 2018, ODG launched a new access platform, which is the ODG by MCG.com website. The goal of the new platform is to provide really a more user-friendly tool that allows healthcare providers and claims professionals and all the other stakeholders in the workers' comp community to communicate to the greatest possible extent. The reason being that we want to expedite quality care and reduce utilization review friction and really speed up recovery and return to work. In short, the goal of ODG and of this website is to improve outcomes for all workers' comp stakeholders. So with that, let's take a look at the ODG by MCG platform. And we are going to start with the homepage because I think if you understand the homepage and how it's organized, then you're really halfway there to understanding how the platform works and what it does. Like I said earlier, the site is designed to be user-friendly, and it has a built-in amount of redundancy. The reason for that is so that users can use any number of ways to access ODG's content, whether it's medical treatment guidelines or duration information or the formulary or any of the tools that are available on the site. Quick caveat. I'm a lawyer by training, and so I look at this site and I look at the information from that perspective as a lawyer and from a layperson's perspective. But ODG includes physicians and nurses and case managers and a number of different professions. And every one of those people, when they do these webinars and they provide this information, has a little bit different take on it, a little bit different perspective depending on their background. We offer monthly training, and we also have past webinars and presentations available for review on demand. And I really encourage you to get on the site. I'm going to show you where to find those. But if you look at those, the more you look at them, the more people you hear present on this site, the better overall perspective you get about how it works and what it does. Everybody that does it will give you a little bit different take on it, and they're all helpful. When I do these webinars, I like to start with the homepage and really work from top to bottom. Like I say, if you understand how the homepage is set up, it really helps you in understanding how the site is designed to work. So that's what we're going to do in starting off today. We're going to look first at the top. If you see where I have the cursor, I'm hovering above the help and training menu. And if you click on that, you'll see it drop down with a number of different options. The top several include training options, and that's provides information for you to go and after this webinar, if you have questions, if you want to look at a tutorial on any particular topic, you can do that using this tab. If you start with a self-paced training, you'll see it will bring you to this page. Each of these, if you click on it, will take you to a short video. For instance, if I click on the Home tab, it's just going to take me to a real quick video that shows how the Home tab works and how it's organized. Likewise, get back to that. If you do that on the duration, length of treatment, all of these, it's going to take you just to a short video that will give you a tutorial on how those tools work. All right, let's back out and we'll look again. Additional information to this under the help and training menu once you have looked at those videos and gone through the information, you can take a certification course. You can also contact our help desk if you have any questions. You'll see if you click on that, it brings you to a customer support form. You can just fill that out and they will respond to you post haste. The last thing I want to show you on this tab is the information and guides link, because there's a number of valuable sites there. Of course, you can look down here and you'll see where I have the cursor. You can check each of those tabs. That will have a written document that explains what those particular tabs are for. A couple of things I want to show you are, first, the methodology. If you click on that methodology link, it'll take you to Appendix B of the guidelines. And that just really gives you a detailed explanation of the methods used by our editorial team to put the guidelines together, what they do, what they look at, how they rank information, and so forth. Likewise, if you keep going down and look at documenting exceptions, anyone who's dealt with guidelines enough knows that on occasion you're going to have a patient where care is recommended that is outside of the guidelines or not included in the guidelines or whatever. When you have those kind of exceptions, if you look at Appendix D, that gives you a process for how to submit or how to request exceptions to the guidelines. So a helpful document if you are looking at some sort of new treatment or treatment that is outside of the confines of the guidelines. And then the last one is you drop down and you look at the suggesting changes link. That takes you to this document. Our editorial team looks at thousands of reports throughout the year and digests those. If there is a report that a treating physician or whoever thinks is not included, or some other basis for updating the guidelines or making changes, this document provides instructions on how you can submit those changes. If there's a new procedure, something like that, and you think that it is significant and the guidelines should be edited to accommodate it, this will tell you how to submit that kind of information. So again, an important document in terms of helping to keep the guidelines up to date and current. All right. So last thing on the help and training tab is the telephone number. You can call our help desk at these numbers should you have any questions and so forth. Let me add to that, just my contact information is on the website or on the webinar today. So you're welcome to call me or any of the ODG staff should you have questions. Okay, next item, if you look down is the ODG by MCG logo. Aside from being a stylish logo, that's also a home key. It's going to be on every page you go to as you navigate through this website. If you are finished doing a search or for whatever reason just want to come back to this home page, if you click on that ODG by MCG logo, that's going to bring you back to this page and you can start over again. All right, let's look at some of the ways on this homepage that you can access MCG or ODG content. And of course, the most common way to access content by far is this search bar that's at the top of the page. It's like any other search bar, just like a Google search or any kind of search you're doing. If you'll just enter your key term into this search bar, for instance, we'll do, oops. I forgot to, there we go. Move my cursor. All right, we'll do a search for lumbar sprain. And you'll see that when you do that, that's going to populate the screen with your search results. And it's going to show that we've got results under our duration tab, our tau index, and our cost tab, right? So if I want to look under my disability duration tab under lumbar sprain, I just click on that. It's going to take me to the duration tab. One of the things I want to point out is that as you go through this, when you do a search and you see these tabs, you'll see here a green check by the duration tab. And of course, that means that there's information responsive to your search in that tab. But you'll also see green checks by the treatment tab, by the tau index, and by the cost tab. That means that in each of those tabs, there's going to be information that is responsive to your search for a lumbar sprain. So you'll probably want to check those tabs as well and see what information is there. The other thing I want to show you is that when you do a search like that and you've searched for lumbar sprain, that term is pinned to your search. You'll see right there, we've still got lumbar sprain. If we were to go back in and do a search for carpal tunnel, all right, you see we're going to get new results. We'll go to topics. Select carpal tunnel. All right, it's going to bring us information about carpal tunnel syndrome, but we've also got that pinned to our lumbar sprain search that we did originally. And you can X those out just by hitting on the X there. And that will remove those terms. So now you're back to just the duration tab with no search terms. All right, let's click on our ODG logo and we'll go back to the home screen. One other thing I want to show you on this search bar is that it defaults to a search by ODG's medical topics database. If you have an ICD-9 code or an ICD-10 code, or you want to find an ICD-9 or 10, or any of these other codes, you can click those boxes. We'll check off ICD-9 and ICD-10. Now let's do a search for lumbar sprain. Okay, you remember what it brought up the first time was just these two terms. Now we're also searching in the ICD-9 and the ICD-10 databases. So it's bringing us up all of this other information as well. You'll see that goes for the tau index as well. We've got ICD-9s and 10s, and same for cost. All right. So if you want to find an ICD-9 or 10, or you want to search by it, or any of these other codes, all you got to do is check these boxes. All right, we're going to uncheck them now and just stay in our medical topics database. And drop down to our tabs. This is really a tab-based system. And all of these tabs represent the various tools that you can use to find ODG content. If you click on a tab, for instance, now you'll see the home tab is lit up because we're on the home screen. If we click the duration tab, it takes us to the duration search page. And we can enter any kind of search there. But you see, as opposed to when we did it under the home screen and we had results for under all of our tabs, this one is going to give us just the results that are under the duration tab. Now, as I mentioned earlier, we're going to have a green check by our duration tab, but we've also got a green check by our treatment tab and a green check by our tau index. That means that there's also relevant information under both of those tabs to our search for lumbar sprain. The other thing that you should be aware of is as you go through these, whatever tab you click on, you can see we can just scroll across them with our cursor. If I click on the treatment tab, it's going to bring me to the search treatment page, but each of them, whether it's the duration, treatment, whatever, it has a short tutorial video. So if you've got questions about it, you're not sure, click on the tab. It's going to bring you to a quick tutorial video that will give you some instructions on how to use them. Okay, so that's another way to access data. You'll see the three buttons below the tabs. It's the duration, treatment, and cost buttons. That's just another way to access those particular pages. If I click on the duration button, it does the same thing as if I click on the duration tab here. If I click on this treatment button, it takes me to the same page as this treatment tab here. Likewise, cost here takes me to the cost tab. But these three buttons really are representative of the three pillars that this site and really any workers' comp claim is built on, and that's duration, treatment, and cost. The longer your duration of treatment, of course, the higher your cost is in a given claim. And the way you impact that is by providing good quality medical care and expediting that and reducing the friction in the UR process to get a quicker recovery and a quicker return to work. You get good medical treatment to an injured worker, you reduce the duration of their disability, and that of course lowers the cost. All right, so each of these buttons is also another way to access each of these particular pages. Let's drop down. We'll drop down to the middle of the page, the home page, and here is another way to access content. You'll see under this return to work diagnoses, these are the 15 most common diagnoses that you'll see in workers' compensation. And if you click on any of these, for instance, a back sprain, it's going to take you to the duration page for back sprain. It does the same thing as if you had entered back sprain in your search bar at the top of the page. Okay, it's just a quicker way to get there if you know, and back sprain is certainly a common search, as are the rest of these. It's just going to do, it's going to be like you entered that term in the search bar, and it's going to take you to the duration page for that search. To the right of that are medical treatments, and again, these are the 15 most common treatments that people search for. Same thing. If you click on spinal fusion, for instance, that's going to take you to the medical treatment page, as if you had searched for, as if you had hit the treatment guideline page and then done a search for spinal fusion. All right, just brings you to this page, and it's just a way to kind of take a shortcut. Jump back to the home page. You can see we've got the 15 most common treatments. One of the things that I want to be sure you're aware of as you go through these things, and really this site generally, is that it is extremely configurable. If your company has 15 different diagnoses that you see, the site can be modified to accommodate those. Same thing for the medical treatments. If you look at to the bottom right, top conditions, again, that just expands those conditions to the top 100 conditions. So if I hit, if I click on sciatica, it's just going to take me to the duration page as if I had entered sciatica in my search bar at the top of the page. All right, so yet another way to access the content. And again, remember, as you go through these, see we hit spinal fusion. All right, it's going to take us to the treatment page for spinal fusion. Oops. Back. If we hit back sprain under the top 100 condition, it's going to take us to the duration page. But again, you've got a green check by treatment, a green check by tau index, and a green check by cost, which again indicates that there's relevant content under each of those tabs to what your search term is. All right, bounce back out of that. This quick start guide at the bottom is just another tutorial video that will give you some instructions on navigating the site. And if you look at the body diagram on the left, each of these dots corresponds to a body system. If you click on that, it's going to take you as if you search that term under the treatment guidelines tab. All right, so that's another way to access these just by clicking on these points. If you hover over each of the points, you'll see that it will pop up and show you which part you're talking about. Some of them are unclear, at least to me, unless I hover over them. But you do that, and it shows you exactly the body system you're dealing with. And the last thing on the home page are these links down at the bottom left. These take you to guidelines for other states that don't use ODG. For instance, if you click on Colorado, that's going to link you to a site where you can find the Colorado guidelines. All right, so the homepage, as it's set up, just gives you a good idea of how the site is set up generally, and a number of different ways that you can access whatever whatever content you're looking for. So now you're going to look into how to access each of those tools. And we're going to start by looking at treatment guidelines. So we talked about how we can access those. We can click on the treatment tab here or the treatment button here. It's going to take us to the same page. ODG in large part is really the core principles are evidence-based data, and the guidelines are about evidence-based medicine, and how you tie that into getting a good recovery and a quicker return to work. All of that ultimately results in lower core costs and a win-win for all the stakeholders in the system. One of the things I want to point out to you is if you look at, I know we mentioned it when we started, under the information guides, if you go down, oops, you'll see a link to the new evidence grading system. If you look at the bottom, previously evidence was graded in 11 classifications. That's been changed recently by our editing staff to 3 evidence grades, and you'll see those here from EG1, which is the highest level of evidence, to EG3, which is a lower grade of evidence. That's important as you go through the guidelines, because one of the things that they do is provide you a summary of the evidence, and that will include an indication of the level of evidence that each guideline is founded on. Quick look here. If you look to the on the search treatment page, as we mentioned earlier, there's this quick tutorial video if you want to see or some more instruction on how the tab is set up. But if you look to the right, you'll see 3 boxes that you can populate to filter your treatment. And we're going to start from the bottom. If you click on that body systems filter, you'll see these are essentially all of the chapters of the guidelines and all of the body systems that they relate to, from ankle and foot all the way to shoulder. So whatever body system you're looking for, you can click on it, and it's going to take you to the guidelines for that body system. We're going to go on with low back. If I click on that, what that has done now is, in the absence of checking any of these other filters, it's brought me to all of the treatment guidelines for the low back. Essentially, this is the low back chapter that we brought up on the left, and you can click on any of these to find those particular guidelines. And if we want to filter that, say we don't want everything on the low back, we just want to know injections. We'll click injections. So now we brought up all of the injection treatments for low back injuries. All right. And now, say I'm a treating physician and I want to know what kind of treatments are recommended. All I've got to do is go to the top box and I can click on recommended. And you'll see we now have 6 results for injections that are recommended or conditionally recommended for low back injuries. One of the things I want to point out is, as you look here, let's look at the categories of recommendations. You'll see you have recommended generally or not recommended, and under the recommended tab, you've got this blue CR as well as a green R. The green R means that something there's strong evidence for it. It is well founded in the literature, and it is recommended generally for this particular injury. When you have a CR, a blue CR, that means something is conditionally recommended. And let's check out therapeutic ESIs for low back conditions. If we click on that, you'll see that it's conditionally recommended. And what that means is you're going to have this blue box under the actual guideline, and that's going to give you that this is conditional, or this is recommended if these conditions are met, if these criteria are documented in the medical records. All right. When you think about it, really everything there's a certain level of condition to it. If someone has a knee injury, even though a fluoroscopy may have a green R by it, that doesn't mean that it's appropriate for that patient. There's always some level of condition in guidelines. The distinction is that if it is a green R and it's appropriate for that injury, then there's going to be generally recommended. If it's blue CR, it's going to be recommended provided they meet the criteria set forth in the blue criteria box. All right, let's bounce back. We're going to go to the home screen and come back to the treatment, the search treatment page. And now we're going to do a search again for the old lumbar sprain. Okay, you'll see that's bringing us up all the treatments, all the information and relevant search results under the treatment tab. And unlike searching on our home page, it's just the treatment tab. Okay, but it does again put a green check by this duration tab and a green check by the tau index to show you that there's relevant information there. So to give you an idea of how each guideline is set up, okay, we're going to click on lumbar puncture for head conditions, just to show you how the guidelines are organized. And you'll see that it has the name of the procedure at the top, the body system that it is applicable to, the treatment type, whether it's diagnostic or surgical, the type of recommendation, and then in the blue box it has the criteria that must be met for this to be recommended. Below that is the evidence summary. A couple of things about the evidence summary that you need to be aware of. The evidence summary is, of course, just a summary of the research that has been done to show that this particular procedure is appropriate as you go through there. You'll see that you have these blue notes indicated. And if I click on that, not only does it have these reference the research underlying this particular recommendation. This in parenthesis EG1 references the level of evidence. And as we looked at earlier, EG1 is the highest level of evidence. So it's a high level study. But if you click on the blue 5, that actually brings up the study citation that you can see where this study was done. And then if you click on this abstract link, that's going to pull up the actual abstract of this study in PubMed. So you can actually go through and see the abstract of the study that was done and find out when it was done and all the relevant information there. All right, so let's back out of that. And we're going to go back to the home page, which we can do. I mentioned earlier, you can hit the ODG by MCG logo as a home key. You can also just hit that home tab. And that's going to take you back to the home screen as well. All right, one other thing I want to show you in the treatment tab. We looked at these filters. You'll see this treatment planning note at the bottom. If you click on that, you can go to any of the body systems. And that's going to bring you to a treatment plan. Each of these treatment plans has this beginning paragraph, which says this is not designed to be a rule. This is not a guideline. What these treatment plans are just a generic summary of the treatment pathway that you can expect. And it gives you an idea of questions to ask and things you may be looking for and what to expect over the course of the treatment. But remember, these aren't recommendations. It's a very generic summary of the treatment that you may anticipate for a given body part. All right, we're going to back out of that. All right, and that tells you generally how you can find the treatment guidelines that you're looking for. All right, remember, go to your treatment tab, check your body system, and then just filter it as you need to based on the kind of treatment and the kind of recommendation. Easy enough. All right, let's head back to the home page. I want to tell you real quick about the tau index. We're going to cover that quickly and then hit the formulary. The tau index it stands, tau is TAO. And we're going to do a search for lumbar sprain from our home screen. And you'll see in the tau index, we get a result for lumbar sprain. So we're going to hit that. If you looked at the formulary, this screen may look a bit familiar to you, and it's set up similarly. The tau index, or the treatment analyzer on outcomes, is designed to show stakeholders how well a particular treatment correlates with a good outcome, a positive outcome. You'll see they're set up by procedure code, by name, group, and so forth. And then they're organized as a default. They're organized by the frequency which they are used in a particular claim. But the real keys here, the tau index is set up on a score range, and the lowest score is a -100, 100, the highest being a +100. Those scores mean how well a particular treatment correlates with a positive outcome. 0 is average. So anything above a 0 is better than average, and is something that should be considered for an automatic approval. The real things that you look for on the tau index are these last two columns. The first one's the payment flag. If you look at green and yellow, those are all positive things. It's thumbs up. Sounds positive. The difference between them is green is evidence-based. That means that there are randomized controlled trials and so forth that support that treatment. And the literature is solid that this is a good treatment that is associated with good outcomes. If you look at this top number, office and other outpatient services, you'll see it's got a green thumbs up, means it's evidence-based, and it has a tau index score of 41.82, which is well above the 0 average point. So this is a treatment that should be considered for automatic approval. If you drop down, you'll see the yellow thumbs up. The yellow thumbs up again means it's something that should be considered for automatic approval, and it's something that correlates with good outcomes, but it needs to be it's data driven. It's not evidence based as much as it's just been shown to correlate with positive outcomes. And the thing that I think is most commonly used as an example is something like a heat and cold pack for a sprain type injury. It's not something that there's a lot of randomized controlled trials or major studies on, but it's commonly used. It's a low cost, and it's been shown to correlate with good outcomes, or at least not cause bad outcomes. So because of that, it's something that is recommended for auto approval. Again, this tool is really just something that speeds up the UR process and allows injured workers to get good treatment quickly and recover quickly. If you drop down, we're going to organize this by the payment flags. And I'm going to jump up. You'll see once we get below the yellow thumbs up, we hit these red flags. And what that is, something that's kind of hard to tell. It's a silhouette of a person with a headset. What that means is not that this is a treatment that should be denied. Look at a couple of things. You'll see the tau index score here of -23, which is below 0. That means this is something that has not been shown to correlate with good outcomes as some of these other ones that have the green and yellow flags on them. It doesn't mean deny. And I have said before, and we'll say again, ODG is not a denial tool. What it is designed for is to approve the things that are appropriate, and then things that may be more questionable, you take a better look at. They may be appropriate for a given patient, but it's not something that should just, as a matter of course, be approved. And that's what you have when you hit this these red flags. Just means something that you need to take a little bit closer look at and spend a little bit more time on UR. All right. From there, we're going to go to the last page, and that's just after the red flags, you hit the black flags. And those are just a black hand. Again, it doesn't mean that it's something that should automatically be denied, but it does mean something that there's not evidence that supports it. It is something that should really be looked at closely and um, really considered before it's something that should be approved. There's not the level of evidence that supports it as a good treatment that correlates with positive outcomes. All right, so that is the tau index. And we're going to click out of our search term, and again, you'll see that if you just clicked on the tau index page, it will bring you to this tutorial video that will give you some instruction on it as well. All right, we're going to hit the formulary real quick. The formulary is pretty self-explanatory, and if you've used it before, you're familiar with it. It's essentially just an index of medications that show what medicines are recommended as frontline medicines that should be considered for automatic approval versus second-line medicines that may want to be reviewed, or you may need to review before you approve them. You can go through and you can organize this table by drug class. You can do it by generic name, by innovator brand, whatever your preference is. We're going to leave it under drug class. It shows whether there's a generic equivalent. The columns that is really significant in this and that people are really most concerned about is the status column. And everyone who's familiar with ODG's formulary knows about the red N flag and the green Y flag. Sometimes they are mischaracterized as yes and no. Certainly the green Y does stand for a yes, this is a drug that is approved as a frontline drug. But when you look at the N, oftentimes people interpret that as meaning, no, this should never be approved. That's not really what the N means. The N means that this is a drug that should not be approved as a frontline drug, but it may be something that's appropriate as a second line treatment. You just need to take a little bit more in-depth look at it. If you click on a given drug, that will take you to the guidelines for it. And we'll give you more detailed information. You'll see that you can hook into Medline Plus. That will give you more information about that particular medication. All right, last thing I want to show you on the formulary real quick is this opioid MED calculator. All right, this is a fantastic tool for if you have a patient that's getting opioids, you want to be sure that they stay within the recommended dosing. And the recommended dosing is at the bottom here. All right, you can plug in the medications that somebody's getting, say, and remember, I'm just a lawyer, so there's no guarantee that any of these are reasonable amounts, but you'll see that if you hit 15 milligrams of codeine per day, the bars above and below the calculator turn yellow. That means you're within this use caution realm. If you add, let's add 15 milligrams of oxycodone per day, you're still there. Let's add some tramadol. And you can just continue whatever a patient's taking. We'll bump that up to 25. You'll see as you bump this up, the bars change color. So now you're in this high risk range. And as you add medications to this, it will continue to go up. Once you get into something that exceeds the recommended limits, these bars will turn black and indicate that's just too much in terms of opioids. If there's a drug that is not in this list, you can type it in here or add the NDC code and it will account for that as well. Okay, so that covers the formulary tab. I want to cover a couple other tools real quick. We're going to jump back to the home page. We've bounced around the duration tab a little bit. ODG, of course, came into existence as a disability duration guideline, and that's still a key in terms of this platform. If we look at lumbar sprain, all right, that's going to bring us, it's going to populate our screen with the results. And if we check lumbar strain under the duration tab, it's going to bring us here to our duration page, and it's going to show the results for lumbar sprain for that search. All right, real quickly, If you look at these numbers first, the MA and the B, these show you the anticipated disability duration for a lumbar sprain. The B is the best practice. If everything works, if you follow the best case management practices, this is the disability that you should anticipate. A shows the average, but that's the average excluding outliers, those really high numbers that are in the top 5 or so % of the claims data. The M number shows the average with those outliers. All right, so those are all critical numbers based on a lumbar sprain. This is what you can expect, and of course you plan towards the 10 days, and you benchmark against this actual average. Some of the information that's included here is this Medline Plus link. You can click on that. That's going to give you additional information that is helpful, really probably to employers and employees as well as the claims adjuster. This has a short video that you can watch that explains back pain generally. That would be helpful as well. It's something that you can share. This is a risk assessment score, and it's a helpful tool, particularly in terms of the claims handling side. If you have a claim that is and you'll see it ranks anywhere from a low risk up to an extreme risk, and that's just based on the facts of the claim. But if it's a low risk claim or a moderate risk, that may be something that you assign to a new or a novice claims handler. If it is a more extreme risk, it's something that you can assign to a more experienced claim rep. All right, take a look up here real quick. This is your disability timeline, and this just plots out those return to work dates, your best practice, average, and maximum. Quick note here: if you hit that RTW prescription, it pulls up this form, and you can populate this form and just use it however you want to. These are automatically populated, but you can type in your information as needed. We're going to enter our date of injury as today. Oops, here we go. You can add whatever comments you want here. Note to the doctor, dear doctor, what's our doctor's name? Dr. Jones. Whatever you want to explain to him. And then you can include, you can also have text that's automatically inserted, or you can customize it as you need to. But as you go down here, you can add all this information however is appropriate. If it's a mild lumbar sprain, you can check that. You can adjust your scenarios here. If it's going to be different, if because of your experience, you think the days are going to be different, you can change that here to, we'll make that 5 days and make this 12 to 15. All right, all that's information that you can change. You can add a job description here, right? And you'll see up here, we've included the box to enclose a job function evaluation, so that when you click on this button down at the bottom, create printable document, you have this nice pre-document that's ready to send to your treating physician to talk about return to work. And that's really the communication channel you want to open up. You want everybody to be working to help this injured worker recover and get back to work as quickly as they can. And if you can provide modified work that does that, fantastic, because certainly the data shows that the more you keep someone involved in the job place, if you can accommodate their restrictions, the better your timeline looks in terms of getting them back to work. So you'll see we have our return to work form. And then we've also included our job function evaluation form. You can fill this in yourself in terms of the numbers, or you can just leave it blank and let the doctor fill it in, and then the employee and the physician sign it. As I indicated earlier, this is customizable. If a company wants to put their logo at the top here, that can be customized so that they can do that. But that's a fantastic form to maintain communication with your doctor. All right, let's bounce back to our duration page. Last thing I want to show you on this real quick is if you look to the left here, you'll see all of these fields. And all of this information is the information that you will find as you scroll down this page. It's a lot of general information, but very helpful information in terms of sort of summarizing a particular claim. You'll see sort of general physical therapy guidelines, chiro guidelines, and so forth. And all of this can be printed and saved and provided to anyone that needs to have that knowledge. One thing I want to show you, or a couple of things I want to show you real quick. If you look up here, you can print this page as a hard copy, but you can also copy a URL, and it's going to bring you back to this exact page. You can copy this, put it in your notes. You can email it to a colleague that has ODG, whatever you need to do, and that's going to bring up this exact same page. So that's a good tool. The other thing is we've looked at this so far from sort of a diagnosis perspective. What's the general expectation for lumbar sprains? If we hit that refine button, we can enter job titles, whether it's heavy employment, whatever the level is. You can enter the state, and we'll stay in Arizona. Claim its age, date of injury. And you can see once you enter the date of injury, it's going to populate the return to work date based on those best practices. If you want to use just workers' comp data, you can hit there. Or if you want to use non-occupational disability data, you can hit that tab here. We're going to use workers' comp data. And then what's really interesting is that you can use all of these confounding factors. You'll see, it's always entertaining to me. As a lawyer, when I hit this, you look at the anticipated duration of disability here. We got 28, 21, and 10 days. When I hit legal representation, it immediately bumps up my timeline. And not only that, it impacts my risk score. It really bumps up the risk of that particular claim, even though it's for the same injury. My lawyer friends will tell me that's because they handle more serious injuries. My claims adjuster friends tell me that it's because lawyers make things more expensive. So I'll leave that to you guys to decide. But anyway, you can change all of that, put it in, and again, you can copy that URL, and it will preserve all of that information for you, so that you can just click on the link and come back to this exact same page with the information you've put in. All right. I'm gonna tell you real quick about the job profile page. That's a page that it has a tutorial, so be sure and go back and look at that tutorial. But the job profile page has the capacity to look at specific jobs. If you identify, you can see up here, we identified, or earlier we identified the job level, but you can type in cashier, and it's going to bring up any kind of any number of cashier type positions, which you can click on, and it's going to bring you up job profiles for those positions. You can look at those. You can customize it based on information from the employer, and take all that and put it together. Again, save it as the URL, and then send that to the physician so that they have a job profile to look at. Again, a fantastic tool in terms of maintaining that open line of communication with the treating physician and the employee and the claims handler, so that you can expedite return to work. All right. And we're going to cover one last thing real quick. We're going to look at the cost tab. And again, you can click on this cost tab up here, or you can click on the button that I clicked on, and that's going to bring you to the search cost page. We're going to enter lumbar sprain again. And you'll see that brings up all of our results under the cost tab. If we click on lumbar sprain, it brings us to this dashboard, which is a fantastic tool for setting reserves. You'll see it gives you the anticipated total cost, and then it breaks it down into the three cost baskets: indemnity, medical, and expense and administrative cost. All right. Again, you can refine that. Let's make it. I'm a Louisiana guy, so let's make this a Louisiana claim with a 50-year-old guy who does medium level work. Oops. All right, and we're going to give him a lawyer. Okay, you can see as soon as you put in all that information, it immediately bumps up your cost expectations. You can adjust this, and you can, if because of your experience with this attorney, you think that this may fall somewhere between the typical and the max, put it there. All right. Now you've got your total cost set there. and it's going to adjust your indemnity, medical, and expenses as well. If you want to put in an average weekly wage, say this employee makes $1,500 per week, you can do that. It's going to adjust, it's going to accommodate that within your numbers. And on top of that, it's going to adjust because we put in the state, it's going to include the state maximum for that, which is again a helpful tool. If you have a med only claim, you can click on that and you'll see a couple of interesting things. There we go. Okay, now we've made this a med only claim. So you see, obviously our indemnity drops to 0. But what's also interesting about this is that the medicals drop and the admin costs drop. And that's because the data shows that when you have a medical only claim and somebody continues to work, not only is their indemnity going to be 0, but the medicals are going to drop as well. So again, a helpful tool to be able to note those. You'll note again your copy URL option that you can do if you want to save those. And you can include that in your claims diary or provide it to whoever needs that information. All right, so that brings us to the end of this demo. It's a ton of information. So once again, I really urge you to go back and look at some of the old webinars, check out the training tools. If you have a question, don't hesitate to call me or one of my colleagues at ODG, and we are happy to answer it. And with that, I think we have just a few more minutes left for some questions and answers here today. Thank you all very much, and I look forward to your questions.